Good morning. My name is Crystal and I'm from William Carey, and I'm here to do a dry dressing change on you. Can you verify your name and your birthday for me? Alright, that's correct. And are you in any pain this morning? No? Alright. I would medicate my patient if she was in any pain before we do the dressing change, about 30 minutes beforehand. And also, do you have any allergies specifically to tape or latex? No? Okay. I've already gathered my supplies. Wash my hands, don some clean gloves, and I will begin by removing the old dressing. The bed is in the position of my waist, so I'm not bending over too far, hurting my back. I will dispose of the dressing and assess the wound, looking for anything that is abnormal, such as redness, edema, or bruising. The wound looks clean and that it is healing well. I will now use my measuring tape to measure, see how long, wide, and the depth if needed. I will dispose of my gloves, wash my hands again, and open my sterile gauze. Then put on my sterile gloves. Alright, I'll be demonstrating how to do sterile gloving technique. I've already washed my hands, and I have my size 7.5 gloves and one extra pair just in case. I want to make sure to prep this on a surface that's dry, keeping a 1-inch border that's sterile. These gloves are latex. I would make sure that my patient doesn't have a latex allergy. Picking up using the cup, making sure not to touch the glove. And now only touching the sterile portion of the glove. And then I'll keep my hands above my waist. I am now sterile. Taking the sterile gauze, I would apply it to the wound. Now this is no longer a sterile procedure, it is a clean procedure since the wound has been covered. I will use tape down on all 4 sides to ensure nothing can get into it. And I would also initial, time, and date the dressing. This procedure is now complete. I'll lower the bed, assess if she is in any pain, if she is in the position of comfort, if she has all of her personal belongings, and if she needs to use the bathroom. Wash my hands, dispose of my supplies. Good morning, my name is Crystal, and I'm from William Carey University. The doctor has ordered for us to irrigate your wound. Do you have any questions for me before I begin? No? Okay. Can I have you verify your name and your birthday? That's correct. Can you tell me if you're having any pain this morning? No? Alright. I would pre-medicate my patient 30 minutes beforehand if he were in any pain. Do you have any allergies, specifically to tape or latex? No? Okay. Well, I will wash my hands, don clean gloves, provide privacy for the patient, and begin by removing the dressing on the wound. Remove. Assess any drainage that's on it. Also look at the wound for any signs of infection. Dispose of that. I would wash my hands and prepare my sterile equipment. This is my irrigation basin that comes in a sterile package. I will open the package. Also, I have gauze to be able to dry off the wound. Open that. I would also don a mask and a gown. And now I'm ready to put on my sterile gloves. I am sterile. I will use my non-dominant hand to remove the basin. Now this hand is unsterile. I will open the normal saline and lip it, and then pour it into. Time and date the saline for reuse. Take the basin and put it below the patient's wound. Also use chucks to collect any of the drainage. Now I will begin irrigating the wound. I will irrigate the wound from least contaminated to most contaminated to prevent any germs from running over the already cleaned portion. I would also keep the syringe 1 inch away from the wound and continue irrigating until all the drainage is clear. I have finished irrigation. I would dispose of that. Also, to prevent skin breakdown, I would clean the peri-wound area around the outside, dispose of that, and then apply a new dressing. Good morning, my name is Crystal and I'm from William Carey. The doctor has ordered for us to do a wet to dry sterile dressing change on your wound. Do you have any questions before I begin? No? Okay. Can I have you verify your name and your birthday? That's correct. Are you in any pain this morning? Or do you have any allergies specific to latex, tape, or any types of bandages? No? Okay. I will wash my hands, don clean gloves, and start by removing the old dressing, assessing the drainage, and also the wound itself for signs of infection. Dispose of that, wash my hands again, and prepare my sterile equipment before I put my sterile gloves on. I have sterile gauze, 2 different packages of it. I have my mask and my gown. Also, I will open the normal saline, lip it, come around the sterile field, and pour it into my gauze to make them wet. And now, put my sterile gloves on. I am sterile. I will use my sterile Q-tip and wet gauze to pack into the wound. The wound is not large enough, so I will simulate that I'm packing it in. I will make sure not to allow any of the wet gauze to get onto the healed skin or the good skin, because that would debride and break down more skin, so only in the wound. Since that is complete, I will now get the dry gauze to put on top. I no longer need to be sterile. Apply the tape. Initial date and time the dressing. Lower the bed. Make sure they're not in any pain, if they need any of their personal items, if they are in the position of comfort, and dispose of my equipment, wash my hands.